Hi, and thank you for joining us today to learn about your total hip or knee joint replacement. What will be covered in this presentation, we'll talk about preparing for your upcoming surgery, we'll talk about the hip and knee, we'll talk about your recovery while in the hospital, we'll cover physical and occupational therapy and their role in your recovery, and then we'll talk about your discharge planning from the hospital. We'll start by talking about preparation for surgery. First, we like to talk about mental preparation. It seems like common sense, but the more that you prepare for something, the better off the outcomes. So when we're thinking in terms of your surgery, if you go into your surgery feeling positive, trying to be relaxed, and thinking optimistically, the better your recovery compared to those that are more anxious. So a quicker recovery, less pain, and less anxiety, which are all great things. Some things that you can do now to prepare your home prior to surgery. Thinking about your home setup, any throw rugs, cords, clutter that might be in your pathways, making sure that you have pathways wide enough to use a walker. Any items that you use regularly in your kitchen or bathroom, trying to move those to a more accessible level so that you're not reaching up or reaching down. Arranging your bedroom and so that you have space to get in and out of your bed. If you are able to have a bedroom on the main or ground level, that would be great. Checking your toilet height and the setup of your shower and having any equipment that you might need to help navigate your bathroom more easily. Thinking about some simple meal preps that you can easily reheat or even just have ready to go for after your surgery, so you're not having to deal with a boiling pot of water and a walker at the same time. And then make sure you count your stairs, and we're talking the number of stairs to go from outside to inside your home and the number of stairs that you need to navigate inside your home to get around safely. Your therapist will ask you the number of stairs, and we'll have stairs that will practice with you during your therapy sessions. And then if you have pets that maybe are jumpers or like to scurry around your feet, maybe having a plan for someone to come take care of them for you or have them boarded for a short time so that you're safe at home with their care as well. Prior to your surgery, there are a few tasks that we'll need you to complete. You'll be asked to see your primary care provider and have their clearance prior to your surgery. You'll have an appointment with our pre-anesthesia clinic where they'll go over your medical history, surgical history, and medications that you're on, and make sure that you're ready to go for your surgery day, as well as complete any testing that may be required prior to your surgery. You'll attend or watch the joint replacement class, which you're doing right now, and then you'll also review the total joint replacement booklet that you will receive in the clinic. Some things to bring to the hospital with you. Any personal toiletries that you wish to continue to use while in the hospital. Loose-fitting clothing, especially pants-wise, so that they're easy to get up and down and able to still do your exercises. If you use a CPAP machine, feel free to bring that masking machine in with you as well. Cell phone and charger, comfortable shoes that are non-slip and closed-toed so that you're able to walk around safely. Eyeglasses in case, if you have that, a copy of your advance directive, an information card if you have a pacemaker, a form of payment for copays for any prescriptions that you might have would be great to bring as well. Things not to bring, any jewelry or large amounts of money. We just want to make sure that those don't get lost as you're moving from place to place throughout the hospital, as well as leave all of your medications at home with you as well, unless told to bring in something specifically in your pre-anesthesia appointment. Otherwise, your nurses will give you all of your medications while you're in the hospital.
Your surgery team wants you to understand the importance of nutrition before and after your surgery to help with successful recovery. Undergoing surgery is a lot like running a marathon. During both, your body requires proper training and nutrition to prepare. Because of this, it's important that you focus on eating a well-balanced diet that includes foods that are high in protein. In addition to food, you'll be instructed to consume a pre-surgery protein drink called Impact Advanced Recovery. This drink contains a unique blend of nutrients that help support your immune system. These nutrients have been shown to help reduce your risk of post-operative complications and decrease the number of days you stay in the hospital after surgery. It's recommended to drink Impact Advanced Recovery 3 times a day for 5 days before your surgery and for 5 days after your surgery once you're allowed to eat. In addition to these protein supplements, you'll also be instructed to drink a clear carbohydrate drink called Ensure pre-surgery the night before and the morning of your surgery. This will be used for carbohydrate loading, which helps get your body ready for surgery. If you have diabetes, your instructions may be different. If you have additional questions about nutrition, there are clinical dietitians available in the surgery clinic and while you're in the hospital who can meet with you to discuss further.
Looking at the weeks prior to surgery, if you use tobacco products, we ask that you stop using those. You'll receive a copy of what we call our pre-rehabilitation exercises that we would like you to start prior to your surgery, so please start those in the weeks leading up to your surgery date. Identifying a support person who can help you during and after your surgery recovery. Make sure that you're drinking the right amount of water and staying hydrated. And then starting the nutrition shakes 5 days prior to your surgery date. When we're talking about a support person, this may be a family member or a close friend that's able to help you in your recovery. Their role would be to encourage you, help you stay comfortable, help you with your exercises from physical therapy, be another set of ears when your nurse goes over your discharge instructions, help you with the transition from hospital to home, and then help you with any chores or errands that you might need, such as purchasing groceries, helping with household chores, running errands, and driving you to appointments or other outings in the community. On the day before your surgery, the pre-anesthesia clinic will contact you with what time you need to arrive to campus on the morning or afternoon of your surgery. You'll drink the last 3 of your Impact AR shakes. You'll drink the 2 Ensure carbohydrate drinks before 11 p.m. We ask that you stop eating food at 11 p.m. unless told otherwise by your team. Clear liquids only after 11 p.m. You'll take a shower or bath with the provided CHG wipes. We ask that you avoid your eyes, ears, and nose. There's no need to rinse, just leave the soap on your skin. And then do not apply any deodorants, lotions, perfumes, makeup, other creams after you have taken the shower or bath. And then we ask that you change your sheets and sleep in clean bedding. On the day of your surgery, you'll take another shower with the other set of the CHG wipes. You'll dress in clean, comfortable clothing. Remember not to apply any makeup, lotion, deodorant, creams after having that shower. You'll drink 1 bottle of the Ensure pre-surgery drink 2 hours before leaving for the hospital. Remember not to have any food or drink 2 hours prior to arriving at the hospital. At your pre-anesthesia testing appointment, they will have gone over which medications they do or do not want you to take prior to your surgery. Any medications that they do want you to take prior to coming to the hospital, you'll take with just a few sips of water. Otherwise, please hold off on any other medications until after your surgery. Remember to remove any jewelry or piercings that you may have on, and then you'll check in with the admissions department at the time that you've been told to check in at the hospital. When you arrive for surgery, you'll remove your clothing and be given a hospital gown to change into. You'll be given an ID band and an allergy band if needed. You'll have an IV started and placed in your arm. They may also draw some lab work at this time. Your surgery site will be marked by a member of the surgical team, and then an anesthesiologist will also come and discuss anesthesia options for you. During your surgery, you will be brought to the operating room and assisted onto the operating table by the operating room staff. You may have a urinary catheter put in, but it's put in while you're asleep and then should be removed once the surgery is completed. Typically, surgeries will take 1 to 2 hours depending on your specific needs and your surgical history. If you have family members or friends that are going to be waiting while you're in surgery, they can do so in our surgery waiting room. We have nurse liaisons that will update them on the progress of your surgery and recovery. After surgery, the surgeon will come and speak with them and update them on how your surgery went. After you're done with your surgery, you'll be taken to our recovery room area to awake from anesthesia, and you have nurses that will be making sure that your pain is under control and that your breathing is doing okay. They may order additional labs or x-rays to monitor how you're recovering from surgery, and then once you're stable, you will be transferred to your hospital room. At that point, any family members, visitors, or friends that came with you will be able to join you in your hospital room. Next, we'll talk about the joint anatomy of the hip and knee. The picture on the left shows a picture of the hip, and you can see that we replace the cup part or acetabulum, also called the hip socket, and then the femoral head, which is another word for your thigh bone. Those are all replaced in a hip replacement. You can see the picture on the right starts to show what we call bone on bone, where the joint has started to decay. On this slide, you can see a picture of a knee replacement. So the femur or thigh bone, the lower part of that, along with the cup part that forms the top of your tibia, is replaced so that when you bend your knee, it's able to glide and move much more smoothly. Now we'll talk about your recovery while in the hospital. We'll talk about who will be taking care of you while you're here. So you'll have your orthopedic surgeon, also called your attending surgeon. You'll also may have a nurse practitioner that's involved in your care as well. Anesthesia and pain management. So of course their most important role is to put you to sleep for your surgery and wake you up when it's concluded, but they will also check in with you periodically during your hospital stay to make sure that your pain is controlled and that you're not having any complications from anesthesia. You'll have a registered nurse assigned to you, and they'll be the ones giving you any medications and relaying any questions or concerns that you have to the team. Patient care assistants, or CNAs, or aides, will be assigned to you as well, and they'll be the ones answering your call light, getting your vital signs, helping you get up and move, and helping with any activities of daily living that you might need assistance with. Pharmacy will see you either the day of surgery or the first day after to make sure that we have all of your home medications ordered correctly in our system, as well as your preferred pharmacy. Physical and occupational therapy will see you either the day of surgery or first day after surgery, and they will help you with your mobility milestones. And then our case manager or social worker will meet with you as well, and they help with our discharge planning. What to expect while in the hospital. Our aides will come by and get vital signs about every 4 hours. Lab will come by in the morning, usually around 3 or 4 a.m. to draw labs. And this is because it does take a while for labs to be processed once they're drawn. And our physician teams typically round starting at as early as 6 a.m. And they like to see that your lab results are in your chart and ready to be reviewed by the time they come to see you in your room. We also have our incentive spirometer, or IS for short. And this is a little contraption that helps make sure you're taking big, deep breaths and keeping your lungs nice and open. Oftentimes when we're not as mobile or laying around in our hospital bed, we don't take as deep of breaths as we normally would or should. And so we ask that you do this 10 times an hour while awake, just to make sure you're keeping your lungs nice and open and taking those big, deep breaths. And then finally, you'll have times with physical and occupational therapy. After surgery, it's very important to use your incentive spirometer, or IS machine. This will help you feel better, help prevent pneumonia, and help clear your lungs and keep them nice and open. We ask that you use this 10 times per hour while you're awake, and below the slide is a picture of what it looks like. We're going to talk about pain management while in the hospital. Our goal is that your pain is managed to a comfortable enough level that you're able to participate in therapies. There are many different types of pain medications that we may use to try to attack pain from different sides, but we also like to mention complementary therapies that can help in addition to pain medications. Ice packs, deep breathing and relaxing exercises, watching TV, listening to music, having distractions such as family or friends coming to visit, and just focusing on experiences or people that help you feel good can all help with your pain management. During your surgery, and potentially once you are in your hospital room, you'll receive IV fluids. You may also receive IV antibiotics for up to 24 hours after your surgery, and this is just to prevent infections after surgery. Once you can tolerate a liquid diet, you'll be allowed to have a regular diet or solid diet. You will also be given nutrition shakes to drink 3 times a day while in the hospital. Please make sure to tell your nurse if you're experiencing any nausea, vomiting, or pain, redness, or swelling at your IV insertion site. Constipation is a common result of surgery and pain medication. It's important to take any stool softeners or laxatives that are prescribed for you to help pass gas, and then have a bowel movement. Please make sure to continue taking these at home as well. You can also drink fluids or eat fiber to help prevent constipation. It's not uncommon for your digestive system to take several days to recover after surgery, and getting up and being mobile also helps prevent constipation and helps your bowels wake up after surgery. Patients that have a total joint replacement are at risk for developing blood clots. There are a few things that we do to help prevent this. The first is mobility. Getting up and moving around and getting that blood flowing is one of the best ways to prevent blood clots. We also may use medications. This could be in oral or pill form, or it could be injectable into your skin. Your nurse or physician team will tell you what medication option they've chosen for you. You may also be asked to wear foot pumps while in bed that just give your legs an intermittent squeeze and keep blood from not pooling in your feet, but helping it go back up to your heart. You may also be asked to wear compression socks or shorts that help with swelling, as well as helping that blood from not pool in your legs and going back up to your heart instead. After surgery, all patients that have a hip or knee replacement are considered at high risk for falling. We want you to be safe as well when you are mobilizing. So we ask that if you need assistance, please push your call light and your nurse or aide or therapist will come help you get up and mobilize. Well, that's what we're here for, is to help you move, and we want you to be safe. So please let us know before you get up. We're going to talk about the daily milestones that we hope all of our patients that have a hip or knee replacement can meet. On the day of your surgery, you'll learn about any pain medications, ways to prevent blood clots, and you'll start learning your exercises. You'll take pain medications and hopefully have your pain controlled. We'll have you sit at the edge of your bed with your recovery room nurse once you're awake and safe to do so, to start your mobility process. There have been studies that have shown that the sooner we start therapy after a hip or knee replacement, the quicker the recovery, the better off the outcomes for you. Once you're on the unit, we'll have you sit at the edge of your bed there as well. We'll then have you start walking with a walker as soon as you're awake and safe to do so. We'll help you get to a chair and eat any meals in the chair. We ask you to drink plenty of fluids and transition from a liquid to a solid diet. We'll teach you how to use your incentive spirometer, and we'll also attach any foot pumps that may be ordered. And then we'll have you start working with physical therapy. On day 1 after surgery, we'll have you learn about medications to prevent constipation and blood clots, continuing to control your pain with medications, ideally oral pain medications only. You'll meet with a member of our case management team to confirm your discharge plans and coordinate transportation if needed, and then continue to use your incentive spirometer and foot pumps. On day 1 after surgery, you'll work with physical therapy and the nursing staff to get out of bed and stand, walk greater distances in your room and in the hallway, walk to the bathroom instead of using the commode, practice using stairs with the assistance of physical therapy, sit in your chair for meals, and using crutches or a walker if required. You'll also work with our occupational therapy team if needed. If pain is well controlled and physical therapy says that you're safe to discharge, then you'll be discharged from the hospital on day 1 after surgery.
So let's talk about some of the goals that you'll have while you're at the hospital. With therapy, we'll be working on getting you in and out of the bed, out of a chair, and in and out of a car. We'll be also talking about how to walk safely with the appropriate devices. This could be a walker or crutches. We'll also discuss how to go up and down the stairs and also have you demonstrate it if needed. We will also go over your strengthening exercises that we would like you to continue when you go home. We will also go over your self-care, which is dressing, grooming, bathing, and making sure that you can perform those things when you go home post-surgery. We will also talk about your home and setup and how to make sure that it's safe for you and how to get around a little easier at home. We will also look at some adaptive equipment and some home equipment that may help you with getting around and being more independent at home. So your therapy schedule when you're in the hospital will depend on when your surgery time is for that day. You may actually see physical therapy the day of your surgery and see if you can at least stand or walk or at least sit in a chair. If you do not see physical therapy that day, then we will see you the next morning after surgery. Typically, physical therapy will see you twice a day. Occupational therapy will be seen once a day as needed. Once your therapy goals have been met, please continue to work with nursing on ambulating, self-care, and your exercises until you discharge. There may be some precautions after your surgery. For hip replacements, there may be some specific movements that you're not allowed to do until you're fully healed. The therapists and nurses will discuss those with you and show you how to get around those precautions. But usually there are no precautions related to this surgery. For knee replacements, the only thing we really ask is not to put a pillow directly underneath your knee while you're in bed. We want to make sure you have a nice straight leg so you can get up and walk and not have an uneven walking pattern. There's some adaptive equipment and some home equipment that we might recommend for you to be able to complete your self-cares. So some dressing equipment we might issue you is a reacher, a sock aid, and a long-handled shoe horn. And then there are some equipment that you could use for your home, such as a commode or a shower chair or bench. And just to let you know, some of this equipment is not covered by insurance. You can usually get a roller walker covered, but the shower equipment and toilet equipment is usually out-of-pocket costs. These are easily found in home health stores or even online.
While you're in the hospital, a member of our case management team will meet with you. Their main role is to help facilitate discharge, verifying insurance coverage of any blood thinners that you may be prescribed, help obtain a roller walker or crutches if needed, and then set up home health if needed. One question that we're often asked is, when I discharge, where will I go? And we take into account your preference, the recommendation from your physician, our physical and occupational therapy team, and our case managers. There are two main routes that people will take. The majority of the time, people will discharge home. This is the safest option for you and allows you to progress more quickly with your recovery. It's recommended that you start with outpatient physical therapy, but if unable to travel or navigate around your home safely, then we may recommend home health physical therapy. Not as commonly, we do discharge patients to a facility. If you need extra assistance or extra therapy prior to discharging home, this may be an option for you. Think about what facilities you may want to go to and have that list ready for our social worker to send out referrals while you're in the hospital. Typical stay at one of these facilities is 1 week or less, so it's a very short time before you would then transition back to your home. Majority of patients are able to discharge home after a hip or knee replacement. Make sure that you have support able to help you at home. We recommend that someone stay with you for the first few days after you get home to help you navigate around your home, help you with any chores that you might need help with, and just make sure that you're safe and able to take care of yourself at home. You will not be able to drive for several weeks after surgery, so please make sure that you arrange a ride or transportation from the hospital to your home at discharge, any follow-up appointments that you may have, and then any outpatient physical therapy appointments that may be scheduled. On the day that you discharge, your nurse will review some discharge instructions with you. We will typically schedule a first follow-up appointment for you that's typically about 2 weeks out from the day of surgery. We ask that you continue to increase your activity, maintaining any restrictions that may have been given to you. Continue wearing your compression stockings for at least 6 weeks after surgery, and no driving until told otherwise by your surgeon. You may be given prescriptions at discharge. You may pick those up at the hospital pharmacy or at the pharmacy of your choice. Typically, these are one-time fills only, and you would need to contact your primary care provider for any refills that may be needed. Typically, we say do not have any dental work done for 3 to 6 months after surgery. You will need antibiotics prior to all future dental appointment visits. Please contact your dentist or the surgeon's office to get a prescription. If you're needing to do dressing changes to your incision, specific dressing change instructions will be reviewed by the nurse prior to your discharge. Do not use any ointments, lotions, powders, or creams on your incision unless told otherwise by your team. If you have any questions or concerns, please contact your surgeon's office. Any bathing restrictions that you will have will also be reviewed with you by your nurse at discharge. Do not submerge your incision in a bath, hot tub, or pool. Finally, you will receive a patient satisfaction survey by email or mail a few days after you discharge from the hospital, and we welcome any feedback that you may have about your stay so that we can improve our experience for the next patient. Signs and symptoms to report to your physician would be signs of a blood clot. This includes sudden shortness of breath, sudden onset of chest pain, localized chest pain with or without coughing, severe calf or leg pain that's unrelated to your surgical incision, any tenderness or redness of your calf, swelling of your thigh, calf, ankle, or foot. We consider this a medical emergency and urge you to call 911 or go to your nearest emergency room. Your surgeon will also want to know if you have any signs of an infection. This includes a fever greater than 100 degrees Fahrenheit, shaking or chills, difficulty breathing, confusion or disorientation, increasing redness, tenderness, or swelling at the incision site, any new or increasing drainage or drainage that has a foul-smelling odor or color, pain with activity and rest, or new numbness or tingling in your surgical leg. Please contact your surgeon's office for further follow-up. Swelling of your surgical leg is common for about 3 to 6 months after surgery. Bruising is common as well, but should decrease a few weeks after your surgery. Thank you for your time and attention and for taking ownership of your recovery by watching this presentation. We wish you the best in your recovery and we look forward to caring for you soon.